Hello, everyone, and welcome to today's session, Understanding the Causes of Kidney Disease and Taking Next Steps. My name is Mike Spigler, and I am the Chief Program Officer for the American Kidney Fund. I'm going to be serving as your moderator for today's session. During this session, you'll learn about the most common causes of kidney disease, including some that are rare or not well understood. We'll also cover how knowing the cause of your kidney disease can empower you to make informed decisions about your care. We will hear from both a kidney doctor and an American Kidney Fund ambassador about their perspectives and journeys. I would also like to thank our sponsor, the Unknown Causes of Kidney Disease Project, for their support of this session. And now I'd like to introduce the panelists for today. Our first speaker is Dr. Jamie Green. Dr. Green is a kidney doctor and researcher at Geisinger. She helps lead the Center for Kidney Health Research and works to improve care for people with kidney disease. Dr. Green focuses on making sure patients have the information and support they need to make decisions about their treatment options. She leads large studies funded by the National Institutes of Health and the Patient-Centered Outcomes Research Institute that both aim to help patients prepare for kidney failure treatment. Her work uses technology and tools in the electronic health record to make care more patient-centered and easier to navigate. Dr. Green, thank you for being here with us today. Our second speaker is Teresa Cauldron. Driven by her personal experience as a registered nurse who faced acute kidney failure, went through dialysis treatments, and received a life-saving kidney transplant in 2020, Teresa has become a dedicated advocate in the fight against kidney disease. For the past 5 years, she has channeled her journey into impactful advocacy, working tirelessly to raise awareness for prevention and to improve the lives of those living with kidney disease. A mother of 4 and married to a fellow nurse for 27 years, Teresa's commitment extends beyond her professional background. She is directly engaged with state and federal government officials, passionately advocating for the passage of crucial policies and laws that enhance access to care, treatment options, and early diagnostic measures. Her unique perspective as both a healthcare professional and a patient brings invaluable insight to her advocacy work. Thank you both for being here with us today. So before we get started, I want to remind everyone that we will have a Q&A at the end of the session, so please feel free to add your questions for the chat throughout today's talk. And now I'm not going to hold things up anymore. I'm going to pass this session directly over to Dr. Green to share her overview of the causes of kidney disease.
Thank you, Mike. These are my disclosures. I do have relationships with Novartis, Boehringer Ingelheim, and Sanofi. They do fund some of my research, although I don't have any specific consulting relationships with them. Today, I'm going to cover, first, I want to make sure that everyone understands the most common causes of kidney disease. We'll talk about, I want to talk about the fact that there are many other things that can cause kidney disease, though, besides diabetes and high blood pressure. And we'll discuss why knowing the cause of your kidney disease matters and how it can help you make informed choices about your care. So here's an overview of the causes of kidney disease. This is from the USRDS. That's our national data system that compiles data from across the country on the causes of kidney failure. And the two most common causes, as you can see on the chart, are diabetes and high blood pressure, which I think you already heard a little bit about from Dr. Nunes earlier today. Diabetes, 37%, high blood pressure, 27%. So the largest part of the graph is those two causes. But there are other things that can cause kidney disease. At 14%, we see glomerulonephritis. I'll talk more about that in a second. And then there are other things, 16% other causes, and then 6% unknown. So the other causes could be a variety of things. They're just not big enough chunks to get a big piece of the pie. Most people in the United States tend to hear about diabetes and high blood pressure, but there are many other things that can cause kidney disease that we want to be aware of. And sometimes when we say it's diabetes or high blood pressure, it's not. So I really want to emphasize that today. Okay, so what about diabetes? Diabetes is the #1 cause of kidney failure in the United States. High blood pressure itself actually damages the kidney tissue, which leads to protein leaking into the urine. That's a characteristic feature of it. So when we're trying to figure out what the cause of kidney disease is and someone has diabetes, protein leaking into the urine is a a characteristic feature. And that's why if you are diabetic, you often get a urine test done by your provider. It should be once a year. That's the standard screen, a urine albumin-creatinine ratio to see if you're starting to leak protein into the urine. This tends to occur about 10 to 15 years after the diagnosis of diabetes. So that helps us know also whether diabetes is the cause of your kidney disease. If you have some evidence of kidney damage, but you were just diagnosed with diabetes recently, that makes it less likely. Also, diabetes being the cause of your kidney disease is more likely if diabetes has also affected other areas of your body. So if diabetes has damaged your eyes, you have vision problems or retinopathy, then, and you also have reduced kidney function or protein leaking into your urine, that makes it more likely that the diabetes is the cause of your kidney damage. And early treatment can really help protect your remaining kidney function. So by knowing that we think diabetes is the cause, we can really work to tightly control your blood sugar and put you on targeted medications or target kidney medicines to lower the protein in the urine. Some of these medicines are things that like ACE inhibitors or angiotensin receptor blockers, like lisinopril or losartan. Some of you may be on those medications, but they do treat blood pressure, but they're very specific for the kidney and they help protect the kidney and slow down progression of kidney disease. Newer medications include SGLT2 inhibitors like Jardiance and Farxiga. Those are diabetes medicines, but again, they really are very specific at helping to protect the kidney. So those are important medications to be on. About high blood pressure. So high blood pressure does damage the blood vessels in the kidneys. The kidneys are really just a ball of blood vessels. Their job is to filter and clean the blood. And so anything that's going to raise your pressure is going to get transmitted into the kidney tissue and can cause scarring over time. And then the kidneys are less able to filter the blood. High blood pressure as a cause of kidney disease, called nephrosclerosis. It's usually seen with long-standing high blood pressure. So you've had high blood pressure for a long time. But this feature or the findings we see in the kidney, if we were to biopsy, can be seen. A lot of things can cause that. And so sometimes it's hard to know if is it truly the high blood pressure that caused that damage, or really is this just a sign of something else that eventually led to scarring and looks like high blood pressure. So it turns out that a lot of times when we say it's high blood pressure causing kidney disease, it may not be. And when we biopsy patients with high blood pressure, when we think it's the cause of their kidney disease, sometimes it's not. So we always want to exclude other causes of kidney disease before we say that it's high blood pressure causing kidney disease. Not to say that it doesn't cause kidney disease, but oftentimes we just say it is when we don't know what else the cause is. But regardless, treating blood pressure helps protect the kidneys. So if you have kidney disease, it's really important to control your blood pressure to slow progression over time. The goal blood pressure should be less than 130/80. Even now, our most recent guidelines even say to get that systolic blood pressure, that top number, less than 120. So we really want the blood pressure to be controlled because the lower the blood pressure, less pressure gets transmitted into that kidney tissue, and it's going to cause less damage over time. But that's how knowing causes can help us identify the appropriate treatment. So the third most common cause of kidney failure, glomerulonephritis, the big word. And I don't always even say this, but because it is listed as the third most common cause, I'm going to highlight it. But glomerulonephritis just means inflammation of the glomeruli. So nephritis is inflammation of the kidney. Glomeruli, that's the functioning filtering units of the kidney. So glomerulonephritis. That inflammation in the kidney can lead to kidney damage over time. It causes blood and protein in the urine, so that's what we see when we're looking. If we see a lot of blood and protein in the urine, not just protein, then we're thinking, oh, could there be a glomerulonephritis? But these often have, patients who have glomerulonephritis often have other signs, other symptoms. They might have joint pain or rash or other whole body symptoms that tell us that there's something in their body, their whole body, that's then affecting the kidney. And so there are a variety of triggers that can do this. It is complicated. So some trigger in your body just, something caused something to start damaging the kidney. So whether that's your immune system, so it could be an autoimmune process, like lupus, or it could be an infection. Chronic infections can do this, or even acute infections like strep. So chronic infections, hepatitis, things like that can cause HIV. Lots of infections can cause the initiation of this inflammation of the kidney and glomerulonephritis. Cancers even. So lung cancer, breast cancer, any cancer. And then sometimes we just don't know. But something ends up happening that triggers inflammation in the kidney, any of these things, and then it presents a particular pattern. And we see this. Usually we need a biopsy. So I put on here that it can be diagnosed through specialized blood tests. And sometimes we can figure it out that way. But most of the time we see blood and protein in the urine. Patients may have high blood pressure. They may have a rash or be swollen all over, swelling. But to really know the cause, we usually do need a kidney biopsy. And the treatment is directed at the cause of the inflammation. So if we think it's an immune process, then we're going to put you on autoimmune medications or medications that target the immune system, like steroids, or even types of chemotherapy. If it's an infection, we're going to treat the infection. And if you have cancer, we're going to treat the cancer. So we really need to understand what the cause is in order to know the appropriate treatment. But some examples of glomerulonephritis include that you may have heard of, and there's many, but lupus nephritis is a common one, although a rare cause of kidney disease. Goodpasture's, IgA nephropathy, post-strep glomerulonephritis, and then vasculitis, which is, in fact, the cause of kidney disease for our AK ambassador, Teresa, who's joining us too today. So lots and lots of types of glomerulonephritis, which is why it looks like it's a big bucket on the slide. We can go back. It says 16%, but really that's just a breakdown of a lot of different causes of kidney disease. Each type of glomerulonephritis ends up being I'm going to see if someone can advance my slide for me because it's not working. I apologize. Thank you. All right. So that's glomerulonephritis. The next slide. Okay, other causes. What else could it be? There are many other causes of kidney disease. Genetic conditions like polycystic kidney disease or ADPKD. Sometimes that is hereditary and you have a family member that has it. But sometimes you may not have a family history of polycystic kidney disease and you're just diagnosed with polycystic kidney disease. Alport syndrome, Fabry disease, APOL1 mediated kidney disease. These are all genetic conditions that could be a cause of kidney disease. And now I know you had a talk on genetics already and the way to do genetic. There are lots of options and ways that we can get genetic testing done. So we're learning more and more that some of those unknown causes of kidney disease end up being genetic. There are other glomerular diseases. So I talked about glomerulonephritis, which is things that cause inflammation in the kidney, but that functional unit of the kidney, you can have other ways that tissue gets damaged. And you may have heard of these. The only reason I mentioned them, minimal change disease, membranous nephropathy, FSGS, those are things that some of you may have been diagnosed with or you may have heard of. So those are other things that can damage the kidney tissue. Prolonged urinary tract obstruction, things like prostate issues, kidney stones, not just if you have a kidney stone, but if you have recurrent kidney stones and prolonged obstruction, you can get kidney disease. Or you could have backflow of urine, reflux, backflow of urine from the bladder up into the kidneys. Medications, especially things like ibuprofen or other non-steroidal anti-inflammatory drugs, those can damage the kidneys over time. And there are many other medications too that can cause kidney disease. And then sometimes, no matter what, we still don't know what the cause, even after we do a biopsy. And then you may be left with just, you have kidney disease of unknown cause. Other things that can contribute to kidney disease I just put them as contributing factors because, the other things that I talked about are things that directly damage the kidney. And these are things that can contribute, but aren't usually the sole cause of kidney disease. So advanced age, the older you are, I shouldn't say advanced, just aging. The older you are, the more likely you are to have kidney disease, particularly over age 60. Smoking, tobacco use can damage the kidney blood vessels, and that can worsen your kidney function. Obesity itself, there are different forms of damage in the kidneys just from being overweight, causes some extra strain on the kidney, hyperfiltration. So being overweight can really hurt the kidneys too. Rarely alone the cause of kidney failure, but it can contribute. Heart disease, same. The heart and the kidney are very closely related as we're learning more and more. Now we even have the new term, cardio kidney metabolic syndrome. So it is important if you have heart disease, you are going to be more at risk for having kidney disease. Socioeconomic factors, so certain racial and ethnic groups are more likely to have kidney disease due to a variety of factors. And so all of those things we're going to be looking at when we're trying to figure out the cause of kidney disease. So putting that all together, how do we figure out what the cause of your kidney disease is? I presented a lot of different information about different types of kidney disease, but when providers are trying to figure out what your cause is, we never want to just say, oh, CKD, chronic kidney disease is your diagnosis. It is a diagnosis. It means you have kidney disease, but it doesn't tell us why. So in order for us to really understand how to treat you the best way, we need to know the cause. So we're going to do a variety of tests, take a history, physical exam, and we're going to try and put the pieces together to figure out what we think is most likely. So physical exam, we're looking for signs of particular types of kidney disease. Anybody with kidney disease may have swelling. Certain kidney diseases cause rashes, joint swelling, and other things. So we're looking on exam for things that could give us a clue. Fabry, for example, even causes a specific type of rash. So we're looking at the exam to see if there are clues to why someone may have a particular kind of kidney disease. We're going to ask in detail your medical history, what chronic medical problems you have, like diabetes, high blood pressure. Do you smoke? Other things. Do you have a history of autoimmune disease? Those things are going to be putting the pieces of our puzzle together. What's your family history? Does anybody in your family have kidney disease or signs of kidney disease? Anybody on dialysis or with a transplant? Because that gives us a clue that maybe there's something genetic going on. We'll ask you about whole body symptoms. So systemic symptoms that might be suggesting that you do have an autoimmune condition or cancer or some chronic infection, other things that could be affecting not just the rest of your body, but your kidneys also. Do you have any urinary symptoms, particularly signs of obstruction, like you're not able to empty your bladder well? Or are you seeing visible blood in your urine, frothy urine? So frothy urine is a sign of sometimes extra protein in the urine. So we ask about those types of things. We'll ask medications that may be affecting the kidney, like the anti-inflammatory medicines I talked about earlier, like ibuprofen, naproxen, those medicines that might affect the kidney, but other things too. So we'll go in detail through your medications. We'd want to ask you about your home, your job, your environment, because all of those things can contribute to your risk of kidney disease. Certain environmental exposures can even increase your risk of kidney disease. And then we'll do some additional tests to help figure out what the cause might be. So in addition to the standard GFR, which is your test for your kidney function, and the ACR, which is your urine albumin creatinine ratio, those are just telling me that you have kidney damage, but they don't tell me why. So additional tests we might do would be a full urinalysis, which tells us whether there's also blood in the urine or inflammatory signs of inflammation in the kidney, so white blood cells in the urine in addition to red blood cells. We can do additional what we call serologies, so immune markers in your blood that can help us identify if we think you might have an immune cause for your kidney disease. You might need extra imaging, like CAT scans, MRIs. A kidney ultrasound would be the first thing we do, but sometimes we need to do additional testing to see if there's something structural going on. And then usually the last or most invasive test that we do is a kidney biopsy, because we wait until we do all those other things first to see if we can figure out what we think the cause is. And then if we still can't figure it out, then we'll do a kidney biopsy. And finally, we have genetic testing, which I'm glad you already had a whole session on. But that is now becoming really a big part of what we do in nephrology, that we have the ability to do genetic testing and figure out if there's a genetic cause. And so many times when we get that unknown cause and we can't figure it out, then we go ahead and we proceed with genetic testing just to see if we're not missing something or if there are clues in your history. Okay, so what's the value in knowing the cause? I covered this a little bit, but I really want to emphasize that it can, I don't know if I talked about this first one as much. It helps us understand what the likelihood that your kidney disease is going to progress. So your prognosis is impacted by the cause. If you have, for example, diabetic kidney disease tends to progress faster than the kidney disease caused by high blood pressure. And so by knowing the cause, then we can help you know how likely is it that your kidneys will fail completely. Maybe you have a low risk of progression, but by knowing the cause, we can help give you more information about your kidney disease and what the prognosis might be. It can impact our treatment plans. So depending on the cause, you might just need standard therapy where we're controlling your diabetes, we're controlling your blood pressure, we're managing your weight, we're telling you to live a healthy lifestyle. All those things are going to slow progression, but sometimes we find other things that might need additional therapy, like immune suppression medication or treatment of infections. So it does really impact our treatment plan. It can impact family planning, especially if you have a genetic condition. And similarly, that you can share information with your family members who might be at risk too, because if you have a family member with kidney disease, they're going to be more likely to have kidney disease too. Okay, so in line with that, there are lots of resources. There's genetic testing now available, as you heard about, and the American Kidney Fund has the Know Your Cause tool. This is online. You can get on their website. I know they'll be disseminating resources for you, but you can get on there and answer some questions and try and see what additional information you might need to help figure out the cause of your kidney disease. So take-home messages. Diabetes and high blood pressure are the most common causes of kidney disease, but it can be caused by other rare or unknown causes, which we're learning more and more about. So understanding your cause can help you make informed choices and get the best treatment for you. There are lots of tools and resources available to help you identify a cause. Thank you.
Great. Thank you so much, Jamie. I really appreciate you covering not only the common causes of kidney disease, but some that are also rare and genetic. And I think to really bring this point home and hear from someone that's experienced this firsthand, I want to turn to Teresa to learn more about her experience advocating for herself to get an accurate diagnosis of a rare form of vasculitis called granulomatosis with polyangiitis, or GPA. So Teresa, tell us your story.
Hi, Mike. Thank you guys so much for letting me be here, and I'm happy to share my story, and hopefully it'll help somebody out there that is listening in. I was working as a nurse in an ER, so you would think if you had symptoms, you would just be on them and be at your doctor's office and get a diagnosis. Unfortunately, that wasn't the case for me. I had about a 2-year period of tons of different symptoms. I did have blood pressure that was increasing. I had my creatinine, my BUN, those were increasing. So everything was blamed on, well, high blood pressure is your kidney problem. We treated that, nothing changed, numbers kept getting worse. Long story short, I won't bore you with all those details, but I ended up in the ER that I worked in acute kidney failure as a patient. And I felt like the minute you turn yourself over to being a patient, especially when you're used to being on the other side of that, you've given up your control over your body and knowledge and knowing what is going on. So there I was told ultimately, after a 2-week hospital stay, kidney biopsy, had I known all the things that Dr. Green just talked about with autoimmune stuff, I had rashes, I had sinus, I had just multiple different symptoms that made no sense individually, but when you put them all together, they made perfect sense. So 2 years, I did not see a nephrologist. I should have asked for a referral, but I didn't really know to. Even though I was a nurse, kidney disease wasn't something that I was real familiar with. So I'm in the hospital, I get my biopsy, and it comes back with, it was at the time they called it crescent cell granulomatosis, which led to the diagnosis of the GPA. So we were immediately able to start treating that, and that was in 2009. I was able to, with treating the autoimmune, keeping it from progressing, trying to take better care of myself, we were able to hold off on needing a kidney transplant, which we knew would eventually come. But in 2017, I did go on the transplant list, and I ended up doing home dialysis, peritoneal dialysis for a little while. And then on Easter, in the middle of COVID in 2020, I was blessed with my new kidney. So that's kind of the story of how I got here. I think having been a nurse, it opened my eyes to a whole side of being sick and not understanding what was going on and the fear of what was going to happen. It really opened my eyes to that situation that most people find themselves in when they get diagnosed at first.
Absolutely. Well, I think it's so important for you as a nurse with a medical background to be able to share some of your own challenges that you're dealing with so that, those that are out there that don't have that background, they're also struggling, can be like, this can happen to anybody. What were some of your biggest challenges along the way in getting that diagnosis?
I think the biggest one was, first of all, knowledge is power. I feel like when you're sitting in a doctor's office on that table, or you're in the hospital bed or wherever, it's a sense of you don't know what to expect, the fear of the unknown, and so that all leads to fear. Knowledge, if we know stuff about what's going to happen, we tend to not fear it as much. And then just being able to speak up and advocate for myself, to say, hey, I know my body. I know that when I tell you I'm tired, I have 4 young kids. Of course, you're going to say you're working full time. You've got 4 kids. You're tired. But I was so tired, I couldn't even, it was all I could do to cook a meal. So I didn't speak up for myself like I probably should have. I wish I could say why. I think it was just a respect for the medical profession. And you feel like, well, if that's what they say, but they don't know you and they don't know your body like you do. So the hardest thing for me was to speak up and say, no, I'm telling you, it's not just tired, it's this, or it's not just swelling a little bit, it's this. I think that was the hardest thing for me, was to be able to stand up for myself and speak up.
And now that you have the diagnosis, I know we've introduced you to some other patients that have GPA and through the Vasculitis Foundation. So I know a sense of community is obviously one big part of it, but what are some other things that have benefited you from getting that accurate diagnosis?
Oh my gosh, just the kind of an inner peace in a way. When you get that diagnosis, no matter what age you are, you have responsibilities. I had children, I had a husband, and we had a whole future ahead of us. My kids were, I think, when I was first diagnosed, I had 4. They were from ages 2 to 8. So what was going to happen? I remember at one point, my little girl, my 8-year-old, asked me if I was going to die. So just that you don't know what's going to happen, and getting that diagnosis lets you form a plan, and you get to take some of that power back and take that control back, and you are active in fixing it and making it go the way you want it to go. So that's huge to me.
Absolutely. So, thinking about what you've been through and put yourself back in time when you were still struggling for an answer, what is something you wish someone would have come through a computer and said to you about, what they need to know about advocating for themselves and asking questions?
It's just, how to do it, just to realize that, when you're in seeing a physician, they're working for you. And I don't mean this like disrespectful to physicians at all. We couldn't do this without them, and I wouldn't be here without them. But write your questions down because you're going to forget. It doesn't matter how comfortable you are with that doctor. It's a scary time that your brain is just constantly thinking. Write your questions down, have someone go with you. Somebody that can help remind you, well, hey, you told me this the other day. So, oh yeah. And just don't be afraid to speak up for yourself. They don't know you. And had I written stuff down, had I taken my husband with me to all my appointments, he probably would have said, no, it's a lot worse than what she's actually telling you. Because we don't want to give up that strength. We want to be strong, and but we need to. A doctor can't help you if they don't know exactly what's going on.
Yeah, absolutely. Well, thank you so much for sharing your information and kind of your experience going through there. Don't go too far away. And actually, I'm going to bring Dr. Green back on screen as well, because we've got about 10 minutes now to open up to questions. So let me just take a look at what we've gotten in so far. First question is, Jamie, I'll give this one to you. My doctor told me the high blood pressure caused my kidney disease, but I never had high blood pressure before. How do I bring this up to my doctor?
Yeah, I think that happens a lot, actually. So I think if you are concerned and you don't feel like you're diagnosed, that there might be another cause of your kidney disease, it's always worth just asking, or asking for a referral. Usually when that happens, it may be because you're just seeing your general practitioner. But anybody can request seeing a nephrologist or a kidney specialist. And if you want to have a more thorough evaluation, you can just request a referral, and we'd be happy to see you and and ask more detailed questions and see if there's any other testing that you might need.
Absolutely. And I think especially if someone ends up in like the emergency department, right? Those doctors just trying to keep you alive and think what the issue is and not really working things out. And if they see high blood pressures there, that might be as far as they go. It's really important, as Dr. Green just said, to really, talk to your doctor and really try to dig into the answers. Jamie, this question was asked of you specifically. Can different foods and fluids contribute to the progression of kidney disease? And if so, which changes in eating are most impactful? And before you answer, I should say, for those of you interested, our Kidney Kitchen website has lots of information on this. I'll ask my team to drop it into the chat, but that's a great start. But Dr. Green, I'll turn it to you.
Yeah, that is a great question. I get this question every day. Patients want to know how their diet impacts their risk of kidney disease, or if there's something they can do with their diet to help protect their kidneys. And to be honest with you, the best thing you can do with your diet, nothing you eat is particularly directly toxic to the kidneys. Okay, I'll say that to start. And a lot of people fear eating protein and that's going to damage their kidneys. I think that there's really not a lot of evidence that that's true. So I don't think that you have to worry about that. So it's not that you're eating the wrong things, but the main thing you want to do is live a healthy lifestyle and have a healthy weight and avoid things like diabetes and high blood pressure. So in that regard, most of the time, the things that are helpful is to eat things that are whole foods, nutritious foods, shop the periphery of the grocery store, eat fresh fruits and vegetables, eat normal amounts of protein, and avoid processed foods. A low sodium diet can be helpful, and to the extent that it may impact your blood pressure. But for the most part, you really just want to eat as whole foods some people will recommend a plant-based diet. I don't think that's not necessary. I think that there's some studies that show that eating a plant-based diet, those people have a lower risk of kidney disease, but we don't know if we prescribe a plant-based diet that actually decreases your risk of kidney disease. So I think there's many different types of diets. Whatever preference you have, just try and eat as many whole foods as possible, avoid processed foods, try and limit your salt, and maintain a healthy weight. And so whatever diet you need to follow in order to maintain a healthy weight, and that's probably the most important thing.
Teresa, you're living this. How do you navigate your diet and nutrition?
I do exactly what Dr. Green just said. I don't drink soda anymore. That was a really hard thing for me, but I feel so much better drinking water. I just try to drink a lot of water. Sometimes I add flavors to it. I try to avoid things that are super salty. I know, like, if I go on a trip and I indulge, I can tell because my rings will be tight, my feet will be swollen. So it's just listening to your body for me is what I do. And when I eat something and it doesn't make me feel well, and I notice I swell and things like that, then I say, okay, I need to back off that. I don't think you have to give up things that you just love. It's just moderation and like she said, eating healthy, and trying to be as active as you can.
Great.
Yeah, and I realized I didn't answer the fluid question, which comes up a lot, Mike. Yeah, so it really needs to be tailored. So, not drinking enough liquids is not really a cause of kidney disease unless it's severe. Your kidney function will fluctuate based on the amount of liquid you drink, though. So on any given day, if you're drinking more or less, you might see fluctuations in your kidney function on the numbers. But in general, it's good to stay hydrated. You want to, try and drink more, not less. But as kidney disease progresses, some people need to be on a fluid restriction. So the fluid recommendations really do need to be tailored and customized for an individual person, because if you have other conditions like heart failure and things, you may need to restrict fluid.
Great, thank you. Teresa, a question for you. What support helped you through processing your diagnosis?
Oh, wow. I had an amazing support network of friends as having been a nurse for a long time. My husband, my faith, but I will be honest, I don't believe in quote Dr. Google, but I did find initially the first thing I found was the Vasculitis Foundation. And then I was able to realize that there were a ton of other people going through what I was going through. So getting plugged into a community was huge for me. I mean, my husband and my family, they love me, but they don't know what you're going through. No one can unless they've gone through it. So being part of a community of people that are in the same boat as you is just, it's huge. Having a place that you trust to get information from. So plugging in with AKF, if I'd have known the website existed and that you were here, I would have been on it like that. Because it just gives you a sense of, hey, I'm okay. There's other people like me, and this is all going to be okay.
Thank you, Teresa. Well, Jamie, we had a whole session before this on genetic testing. We didn't do a deep dive on a kidney biopsy, but biopsy can sound scary to people, right? Because it's a lot of times associated with cancer. That's pretty much the only way they hear about a biopsy. Can you talk about what a kidney biopsy is and kind of what the risks might be for that, if there are any?
Yes, sure. A kidney biopsy is biopsying the kidney tissue. Um, it's just like if you had a skin biopsy or anything else, it's just an organ though inside your body. And so your kidneys are located behind the deep muscles in your back. So in order to do a kidney biopsy, we have to go through the skin and reach the kidney tissue. Nowadays, that's usually done through interventional radiology, or thumb imaging technique. So we can directly visualize the needle going through the skin. You're numbed up just with local anesthesia. It's a same-day procedure. It takes maybe 30 minutes to do a kidney biopsy. The main risks would be bleeding, because the kidneys are, as I mentioned previously, just a big ball of blood vessels. So that being said, the risk would be that when you're going into the kidney tissue, you could cause bleeding. Most of the time, that's very minor. You might just see a little bit of blood in your urine, but occasionally the blood could swell around the kidney, and then that just resolves over time. So but it's something we monitor. All that being said, I think kidney biopsy nowadays is safer than it ever was because of the imaging techniques we have. And if someone's recommending a kidney biopsy, usually it's because they feel that the benefits outweigh the risks, and that the need for a diagnosis is so important that we want to take that risk, because without knowing the diagnosis, your kidneys could fail, and then you may end up on dialysis. So if we're trying to figure out the cause, it's so we can treat your kidneys and help make them better.
So last question before we turn to kind of your final thoughts and wrap up. But what, and I know this is a tricky question, but this is for you, Jamie. What is the value of routine genetic testing to ensure nothing is missed?
Yeah, that's a tough one. And I'm just as guilty as like sort of wanting to know. But I think it's not just the value, but what are the risks of routine genetic testing? I think that it would be great if we could do genetic testing on everyone. However, sometimes we end up, we're so advanced, but yet not quite there. So sometimes we find things that we don't know what to do with. There are variants of undetermined significance where you're sort of left with something that may or may not be the cause of your kidney disease. And as of today, we don't think it is, but in 5 years, that actual mutation we might realize is a cause. So it's a real pretty, it's not a, it can be an involved process. So I don't know that I would advocate routine genetic testing, but I think if you're someone who has kidney disease and we've gone through all these other investigative techniques and we still can't figure it out, then, or if there's some clue that suggests a genetic diagnosis, then I think that genetic testing is definitely important.
Awesome. Thank you very much. Well, before we close out, I want to ask you both to share one thing that you'd like our audience to know and one thing you'd like our audience to do based on today's session. Jamie, I'll start with you.
One thing I'd like you to know is just that it's important to know the cause of your kidney disease. It's not just the diagnosis having CKD. I think knowing what the cause is really important so that it can guide our treatment and it can impact your life plan. So I think that's the thing that you need to know. The thing you need to do would be to, if you don't know that, figure out what it is. So whether that's reaching out to the, using the American Kidney Fund, know your cause tool, or talking to your doctor, or getting a referral to a kidney specialist, or even genetic testing, go for it. I think now's the time to take action.
Thank you. Teresa, one thing to know and one thing to do.
I think one thing to know is that, you're not alone in this and that you have the power. You know your body, and don't be afraid to speak up for yourself and ask those questions. I never asked for a nephrology referral, and maybe if I had, I could have avoided a transplant altogether. Who knows? So the one thing to do, I think, is just be your self-advocate, get yourself plugged in, find a group. Facebook, social media is huge. You have to be careful a little bit, of course, but I know AKF has lots of different Facebook groups. The Vasculitis Foundation does. Whatever the cause, if you know that, get plugged in, and knowledge is power. So I think that's get your control back. That's what you need to do.
Thank you so much. Well, Dr. Green, Teresa, thank you so much for this engaging discussion. Thank you all for joining us today. I'd also like to again thank our Unknown Causes of Kidney Disease Project sponsors for making today's session possible. Thanks, everyone, and have a great day.